So Andreas, you're a professor in radiology imaging here at the University Hospital in Zurich, and therefore I'm very glad that we can talk about this global novelty with you today as an expert. Thank you so much.
Yeah, thank you for coming here, Anna.
So, as I said before, we're standing in front of a global novelty, a spiral CT or a CT scan of the breast. Can you tell me a little bit about mammography and the CT scan, and what are the differences between these two methods?
Now, first, let's talk about conventional mammography. Conventional mammography saves lives. So it is known since a long time that mammography screening is able to reduce mortality caused by breast cancer. And therefore, it's a good technique because it saves a lot of lives for women. However, conventional mammography is hampered by several weaknesses. And one of the weaknesses is that it is a 2D projection technique. That means that the breast tissue needs to be compressed by two plastic plates, which might be quite painful. And a lot of women fear that if they go to mammography screening, that they will feel a lot of pain during the examination, because 4 projections usually have to be required, 2 on each side. So that is one of the big advantages of this new system. It is completely pain-free because a compression is not necessary anymore. So the second weakness of conventional mammography, and there is a lot of talk at the moment about it, is that in case of dense breast tissue in the patient, the sensitivity for the detection of breast cancer is strongly reduced. The reason for that is that it might happen that a small breast cancer is not visible in conventional mammography because it is hidden behind dense breast tissue by superimposition. And here again we have a big advantage of this system because it's a true spiral CT system. It acquires true 3D images, and superimposition of tissue is not an issue anymore.
So sensitivity might really be much higher, which we don't know yet, but it could be.
It's a brand new system, so there are no clinical studies regarding that. So we first have to perform clinical trials to understand the exact sensitivity of the system, but at the moment it seems quite logical, because it's a 3D system with true 3D imaging, that the sensitivity will be higher compared to mammography.
That's brilliant news for many women in this world, obviously.
Yeah, I'm sure about that.
Many people, though, are concerned about radiation dose. What can you say about the radiation dose?
Later on we will see that there is a new detector technology in this system, a so-called single photon counting detector. And that detector is extremely sensitive for the detection of X-rays. So because of that, it was possible to construct a system that has more or less the same radiation dose like a conventional mammography.
So Andreas, thank you very much for the thorough introduction to the spiral CT, or the CT scan of the breast. I would like to know how it works in real life. Could you make a slight demonstration?
Yeah, so we see our installation here. This is the first spiral CT for the breast worldwide, and on top of it is the patient table. So the patient will lie in prone position on this patient table, and the breast is introduced in this tube, what we see here. So now let's have a look inside. Here we see the construction from inside. This dark structure there is a photon counting detector, a very, very sensitive detector for the detection of X-rays. And on the left side we see the X-ray source. And the whole system will rotate during the examination, and it will also be lifted. So that is the spiral system of this breast CT scanner, the novelty of it. And as we see as well, there is the patient, the tube for the breast of the patient, and we can easily understand that a compression is not necessary anymore because the system is rotating around the breast.
That's quite a relief for many women.
Yeah, I guess so, yeah, because usually it's very painful.
Brilliant. Thank you.
You're welcome.